Medicaid Expansion, brought to you by Becky, Jennifer, and Cece. Our objectives: explain the coverage disparities of Medicaid expansion versus no expansion. How does Medicaid expansion help the healthcare cost burden? And what income levels qualify for the coverage under the new Medicaid expansion? Before we can analyze the data, we need to discuss what Medicaid expansion is. Some states have expanded Medicaid to cover households that have an income below a certain poverty level. This expansion addresses the group of people in the population that are at the lowest poverty level, but those who are generally lower income without the appropriate funds to purchase appropriate insurance coverage. How to qualify? According to healthcare.gov, in states that have expanded Medicaid coverage, you can qualify based on your income alone. If your household income is below 133% of the federal poverty level, you qualify. Some states, however, have elected to not provide coverage to this population. For this presentation, we will focus on the states of Texas and Illinois. Texas is a state that has decided not to expand Medicaid coverage, and Illinois is a state that offers expanded Medicaid coverage for its residents. Texas versus Illinois, a breakdown. First, here's the year that Medicaid expansion took place in Illinois. There are four population categories being represented, including private, age 19 through 64, that are self-pay, no charge. Age 19 through 64, Medicaid. Age 19 through 64, and Medicare is age 65 plus. When we first looked at this data, we were unsure how to read it. The important to remember is that Medicaid expansion equates to less of the population that is uninsured. To properly evaluate the impact of Medicaid expansion by state through this graph comparison, it would be beneficial to review the changes in the graph that shows the changes in self-pay no charge, age 19 through 64. We chose the injury category to compare between Illinois and Texas, with focus on the self-pay category before and after Medicaid expansion. We will start with the state of Illinois. Remember, this is the self-pay category. And in 2014, Medicaid expansion took place. In quarter four, right before Medicaid expansion took place, there were 1,450 self-pay. However, if you compare that to 2018 quarter four, only 650 cases were in the same category. Now let's move on to Texas. Remember, this is the state that decided to not do Medicaid expansion. So for 2013 quarter four, there were 4,600 cases related to injury. If you compare that to the most recent data, quarter three of 2019, you will see an increase of 6,350 cases that are self-pay. So the next question we must ask is, how did Medicaid expansion actually affect hospitalization in each category? Remember, the categories for payment are Medicare, age 65 plus, Medicaid, age 19 through 24, private pay, age 19 through 64, and self-pay, no charge, age 19 through 64. So let's take a look at the Illinois hospitalizations in quarter 1 through 4 of 2013. Remember, this is before Medicaid expansion. So over those quarters, Medicare age 65 plus, the numbers decreased by 12,500. Medicaid age 19 through 24 decreased by 3,350. Private pay age 19 to 64 increased by 400. Self-pay or no charge age 19 through 64 decreased by 1,400. And here is the most recent data on 2018 quarters 1 through quarter 4. Medicare age 65 plus decreased by 4,250 cases. Medicaid age 19 through 24 increased by 300 cases. Private pay age 19 through 64 increased by 1,150. The self-pay no charge ages 19 through 64 increased by 1,150. So now a comparison between 2013 quarter four before Medicaid expansion and 2018, our most recent information that includes Medicaid expansion for the state of Illinois. The Medicare age 65 plus increased by 7,450 cases. Medicaid age 19 through 24 increased by 8,400 cases. Private pay age 19 through 64 decreased by 7,400, and self-pay, no charge, age 19 through 64, decreased by 10,350 cases. So, how does coverage affect hospitalization? We'll start with Illinois. For Illinois, residents with insurance of Medicare or Medicaid, hospitalizations in total for both groups increased by 15,850, and those with private pay insurance, hospitalizations decreased by 7,400. That means over 15,850 residents were now able to have access to hospitals and to be treated appropriately for their diseases. For those without insurance or the self pay category, hospitalizations decreased by 10,350. The self pay hospitalization numbers are most likely reflective of the increased number of Illinois residents able to now sign up for Medicaid due to the expanded criteria. This is a graph that summarizes all the information we just went over. In quarter one of 2013, before Medicaid expansion, the arrow is pointing to the self pay hospitalizations. In quarter four of 2018, after expansion, this is the same amount of self pay hospitalizations. Now let's move on to Texas hospitalizations. Remember, Texas is a no Medicaid expansion state. These are the numbers for 2013, quarters 1 through 4. Medicare age 65 plus, the numbers decreased by 19,900. With the current Texas Medicaid ages 19 through 24, the numbers increased by 2,300. Private pay age 19 through 64, the numbers increased by 7,800. Self pay or no charge ages 19 through 64 increased by 850. And now we can move on to the most current 4 quarters of Texas, and that is quarter 4 of 2018 versus quarter 3 of 2019. Over that time, Medicare age 65 plus, numbers of hospitalizations decreased by 2,600. Current Texas Medicaid ages 19 through 24 increased by 2,350. Private pay ages 19 through 64 decreased by 1,700. And self pay, no charge, the numbers increased by 6,600. So now we compare the numbers. 2013 quarter 4 and the most recent quarter 3 of 2019 for Texas. The Medicare age 65 plus hospitalizations increased by 22,700. Medicaid ages 19 through 24, the hospitalizations increased by 3,650. Private pay age 19 through 64 increased by 4,550. Self pay, no charge, ages 19 through 64 increased by 11,250. So, what does that mean for insurance coverage and hospitalizations? Remember, Texas did not vote to expand their Medicaid, so their data just shows yearly hospitalizations. For those with Medicare, Texas's current Medicaid system and private pay insurance, hospitalizations increased a grand total of 30,900 in 2013 quarter 4 through 2019 quarter 3. Texas self pay or no insurance increased by 11,250 residents in the same quarterly comparisons. Here's a chart to visualize what we just talked about. The chart starts with 2013 quarter 1. The arrow points to the self pay category, the yellow bar. And the last quarter, down here, quarter 3 of 2019, is also self pay. The bar may look about the same size, but in 2019, that little tiny bit that's higher considers a lot more people without insurance that are being hospitalized. Now, here's a self pay comparison between Illinois and Texas. Illinois in 2018 quarter four for self-pay was 9,050 residents. Texas's self-pay for 2019 quarter three was 68,650 residents. This is a marked difference in residents with no insurance between the two states. If you need some more breakdown, that's 59,600 difference in residents able to qualify for the expanded Medicaid program and are able to receive appropriate hospitalized care. Healthcare expenditures. Gruber states that the US spent 6% of its GDP in healthcare in 1970, but now it spends 18% of its GDP in healthcare. That's 8% higher than other countries. The higher expenditure in healthcare in the US is not produced a higher life expectancy, however. We spend much more in healthcare in comparison to other countries, but they have higher life expectancies and health outcomes. Healthcare utilization has increased due to the Affordable Care Act and as evidenced by the Illinois data, which showed higher rates of hospitalizations after the Medicaid expansion rollout and decreased self pay hospitalizations. Insurance influences hospitalizations because higher cost hospitals provide higher quality care and procedure costs, and hospitalization costs can vary due to competition from neighboring hospitals and negotiations with managed care insurers. For those without insurance, these costs could become astronomical. The history of Medicaid expansion in Illinois and Texas. Illinois, then Governor Pat Quinn signed Medicaid expansion into law on July 22, 2013. Approximately 342,000 low income Illinois residents will be newly underinsured under this expansion. The state implemented the expansion on January 1, 2014. In Texas, then Governor Rick Perry and the Republican majority unanimously rejected the Medicaid expansion. Perry's successor, Governor Greg Abbott, also opposes Medicaid expansion. The Affordable Care Act and the Illinois Public Act 98-104 has allowed more people to become eligible for Medicaid in Illinois. Now, all 19 through 64-year-old U.S. citizens who have legal status with a monthly income of less than $1,366 per individual or $18,045 for a couple are now eligible. The coverage provides health coverage for low income people, seniors, people with disabilities, parents or caretakers of dependent children, pregnant women, and children. Some additional information on the Illinois expansion. The federal government paid 100% for the costs for Medicaid expansion through 2016 for the states that chose to expand Medicaid. Illinois has a population of 12.5 million, with 20% covered by the Medicaid or CHIP programs. 600,000 people gained health coverage since Medicaid expansion in 2014. Illinois has seen a decrease in the uninsured from 12.7% in 2013 to 6.5% in 2017. In Illinois, Medicaid provides assistance to Medicare enrollees via assistance with premiums, cost sharing, prescription drug costs, and long term care expenses. And here are some additional points for Texas. Remember, Texas was a non expansion state. They have not accepted federal Medicaid expansion. That's $114 billion that they will walk away from in the next 10 years from not expanding under the ACA guidelines. Texas has the biggest coverage gap in the country. 761,000 residents don't qualify for Medicaid or for premium subsidies off the health exchange. As of 2020, Texas's population was 29.4 million people, and that's over double the population of Illinois. 1,685,000 additional people would gain health coverage if Texas decided to expand their Medicaid. Texas opted out of expanding Medicaid, but they did get ongoing funding from CMS to help cover uncompensated care in their state. For 5 years, 2018 to 22, they will receive $25 billion in federal aid in covering the healthcare costs for the uninsured. The cost of uncompensated care for Texas hospitals is $5.5 billion a year. and it's mainly paid through taxes and higher premiums. Some conclusions that we have drawn from this project. Medicaid expansion decreased the self pay burden of hospitalizations in Illinois. This allows for increased reimbursement for healthcare, increased coverage for more Illinois residents, including the disabled, pregnancy, as well as children. Texans pay for the uninsured through increased taxes and higher premiums for those who pay for insurance. And many Texas residents would qualify for Medicaid expansion if the coverage was available. And here are the references that we used.